All right, gang, I am on with my allergist, certified allergist immunologist, Dr. Siri, who practices here in Central Illinois. Has her own practice, her own, what is it, Dr. Siri, a trial clinic, and has a food treatment center, food allergy treatment center as well, which we definitely are patients at. And today we are diving in on egg allergy. I know I am milk allergy mom, but I have been an egg allergy mom before, and we get lots of questions about egg allergies from our community because a lot of times families are allergic to both milk and egg. So Dr. Siri, thank you for being on with me. And we want to ask you, the big news in food allergy right now is about oral immunotherapy and treating food allergies and food challenges to see if our kids are really allergic beyond just what blood tests and skin tests say. So today we want to ask you quickly about egg allergy treatment. If a kiddo goes in and does an egg challenge and fails it, which my kiddo did with milk, we then said, hey, let's start doing some treatment for this to see if we can get it better. So how does that look in the egg allergy family?
I would say that it's very, very similar. You know, there are going to be some considerations where a child probably is not a great candidate for OIT or any therapy at this time, and that includes severe anaphylaxis with hospitalization in ICU or bad eosinophilic esophagitis with that food being trigger. Mm-hmm. So whether it's milk or egg, right now anyway, without additional biological medications or other additional support. So those types of kids are probably not the best suited. And of course, we always talked about having those allergy bucket controlled. So treating your allergic rhinitis, making sure your asthma is in really good control, making sure eczema is in good control, those things before anything new gets introduced and, something that may be disruptive. And of course, having a stable, healthy regimen, parents, hopefully having a good solid, wake up routine, bedtime routine, those kind of things. You're not traveling a lot, those kind of things. And once we have established all those things with egg, I think the specific question was, if my child has gone into a medical office with an allergist immunologist who's board certified and has failed a baked egg challenge, meaning that it's been cooked for 30 minutes at least 350 degrees and it's in a food matrix like a wheat muffin or something like that, and failed, is my child a candidate for anything else, or should I just give up and just avoid egg for the rest of our life? So the answer simply is your child is still a candidate for egg oral immunotherapy. Of course, oral immunotherapy is used even in severely allergic peanut kids and tree nut kids. And so then you just realize that at that failed challenge, I think everyone had anticipated or hoped that the child would pass and then life would be beautiful, but some kids don't. And so then you just have to scale back and say, okay, let's go ahead and do a treatment plan where we do a small dose and gradually increase the dose, flying under the radar so the child does not have allergic reactions, to get the immune system to get used to it or tolerate it, kind of like allergy shots, except orally, so that the child can reach that stage at some point. So your child hasn't graduated to baked egg yet, but they will slowly start that desensitization process. And then you can just go straight to egg OIT, or in our practice, we do a lot of baked egg OIT because it's a smoother, easier process. And we do the same exact thing, except with baked products.
So I know we failed a milk challenge. We start milk OIT, and you did baked milk with us. And so you're doing similar things in your office where baked egg is an option. Same kind of picture where it's just going to be less invasive. It's going to be slower. You're going to hopefully have more success, and just, you and I like to say low and slow. And so you prefer to do low and slow with egg as well, just like with the milk?
We offer it to parents in either respect. And frankly, a lot of times the kids weigh in because most of the kids don't want to eat egg, or maybe they rejected the food or they were like, I'm not interested in eating that, but do I want to eat muffins? Yes. And so same, most kids will say, my goal is to get to pizza. I mean, most kids aren't like, I don't want to drink a glass of milk because it's not really palatable and they're still
yes. My child's goal was not to drink a glass of milk. I'm just going to say pizza and ice cream were the goals. So yeah.
Yeah. So I think you have to take that into consideration. And some parents are gung ho and they're ready to go and they want to get this process done and they've got, somewhere to do it. And some parents are like, we want to take a time and we want to just eat some foods, enjoy it, have it be more of a process where, it's more natural, kind of like you would do naturally anyway, because as we talked about, the majority of kids who are allergic to egg or milk can't tolerate baked in foods. Of course, you would challenge that with your allergist immunologist or
Right.
discuss that with them.
Right. And not all doctors are doing this. So if you watch this video and it sounds interesting and you want to ask, you can ask your allergist and you will find out if this is something they do or don't do. It's not that they have to offer this. And I've always said, I wouldn't want to go to an allergist who I'm forcing to do this for my family. That's not what you want. You want a board certified allergist who this is what they love to do for families. They love to hear your goals and help you meet those. And you've done that huge for us with milk. We have gotten to pizza and we still have more goals. We're going nice and slow. And so you do the exact same. You can, some allergists can and will do that with baked or with egg allergy, which is awesome. It's such a, Dr. Siri, that moment where you go in and do the challenge and you fail and you just feel like the world just ended. And then the doctor comes back and says, well, you're a great candidate for, I remember you doing this. Maybe this is why it rings so true with me. I remember you being like, well, he's a great candidate for treatment. And a mom's reaction is in that moment is just like, no, we're a horrible candidate for anything. We're going back home and we're just going to keep doing what we're doing. So, maybe it needs to be a net new appointment where you can get your mind just wrapped around what just happened and come back when you can just reset and be ready to talk about treatment. Or maybe that's just the great news that a mom needs to hear at the end of a failed challenge. I'm sure it goes either way in your office, but am I the only mom that looked like a deer in headlights when I just failed? I don't like to fail anything, Dr. Siri. So it's like, well, failed this. Now guess what? You get to have this great treat of coming in for treatment. And I was just like, oh my gosh, what are we talking about? I'm just being like a real mom here. Like, what did the moms do when you do that to them? Tell me.
We have more options now. So sometimes we offer actually sublingual immunotherapy. So we're one of the practices that offer that. So sometimes when the parents are not necessarily ready and they need to think about it and contemplate it, then, a good bridge is actually sublingual immunotherapy. So drops under the tongue, they're low quantities, they're usually, a few milligrams at the top dose. And so then it's a bridge to something else. For some kids, they will maintain on that for a long, long period and still be able to afford some protections against anaphylaxis.
So SLIT can be a bridge from a failed challenge to OIT. It's a very diluted treatment, and that can just be the little baby step that you need. That's true. I do like that for sure. That was definitely an option that you gave to us. And again, a doctor's not going to make you do this at all. They just tell you that it's an option if it is, and then you can decide if that's what your family wants to do, which is great. So I love that. Well, Dr. Siri, thank you so much for talking egg allergy with us. Maybe next time we will dive into something totally different. But is the egg the one that's closest, like a treatment, the closest to milk's allergy treatment? They seem similar in that you can do the whole baked and all that stuff.
In terms of, having baked versus unbaked, yes. All the other foods are basically, they don't really have the same aspect of denaturing with high heat. And so that's why milk and egg are kind of cool in that way that,
right.
You can add to a food matrix. And again, if you fail a food challenge, you also have to step back and think, why did I fail? Was my child sick at the time? Were they having really bad allergies at the time? And then they could catch one of your other videos about our recommendations. But, most food challenges should be on an empty stomach, child is healthy, all the other health issues are controlled. They're still taking all their other medications except for antihistamines and, maybe a few other medications that might mask the treatment plan and all those other things that we talk about. And so maybe there's a reason they failed. Maybe they were just going into an illness.
That is true. I will say we have done a challenge before or testing with an ear infection before. So I did not know that was coming on. So yes, totally. So many different pieces. A good allergist will walk you through that, give you options, and a challenge, a failed challenge is not the end all be all in most cases. There's possibly something more that can be done to help you reach your goals, and it's great to the whole lesson here is to communicate with your allergist, know your goals, know your comfort level, and freedom can be found in food allergy life. And that's why I love to do these videos, because when a family hears this and knows going in, like, so I was the deer in headlights hearing we failed and now we can do treatment, which shocked me. Now if a mom hears this when we have these talks and communication, that gives them one step closer to understanding and realizing that there are options out there. And hopefully that can help them in that small window of time that they have with their allergist in an appointment to make some changes for their family that could be really exciting. And having experienced that myself, I know it's worth to have that knowledge to be able to move the needle in your allergy journey. Do you have any last words for us, Dr. Siri?
I think the moms know your child really well, and the dads out there too. So I would say trust your instincts. So, it's totally fine to question, to ask. Oops, sorry about that. Yeah, to ask and to, before each dose is given, to confirm the dose. Most people will not be offended. It's your child, your safety. If you're going home and you're, questioning, is my child having a reaction? Trust your instincts, because maybe they are, and maybe there's some factor that's been added in. Like they are sick, or there's an ear infection going on, and they're not tolerating the dose. And so often we've seen that, sometimes, and do communicate. So sometimes people change from eating one food product to another food product, and they have more reactions, and they didn't communicate that. So for example, we had a kiddo who was waking up and she did yogurt. So now we're sort of shifting back to milk, but she did yogurt and switched from regular yogurt to Greek yogurt, which is more concentrated, has more protein. And then she started having reactions. And then, so, had she called us and told us she was going to switch products, which we tell people not to do without letting us know, then we would have informed her, hey, you need to back off a little.
And that's a lesson on diligence. Doing any kind of food treatment is going to take a lot of diligence and as much hard work as strict avoidance. I can attest to that. So be in communication with your allergist. Know that there are options out there. Make sure your allergist is aligned with the kind of things that you're willing to do in your food allergy journey. And know that no matter what stage you are in food allergy life, it requires diligence to keep our kiddos safe as we work through the different options that we have available to us. I know my kid will probably always carry an EpiPen and always need to be diligent, even though we have managed to do some treatment successfully. So, it's a diligent lifestyle, but it can definitely be a life full of fun and freedom. And a good allergist will definitely help you be able to get there. So thank you for being such an amazing allergist for us, Dr. Siri. Where can people find you if they would like to talk to you more about food allergy testing, treatments, or just to learn some good information online?
Well, I thank you for inviting me to be here today with you this awesome bright morning where it's super warm in central Illinois. But we are in Bloomington Normal, and we are in Springfield, and our phone number is 309-452-0995, or in Springfield it's 217-717-4404, and we have a website. It's www.asthma2.com, which is ASTHMA, the number 2.com.
Awesome. Thank you so much for being here, Dr. Siri. I look forward to our next talk. I can't wait to see what it'll be about.
Bye.
All right. Have a good one.
Have a good day.